Come on, you can do it. Almost there. Almost there. Okay, now we're ready. So let's share my screen. All right, so for our final topic that we want to cover today is we started talking about trauma and trauma responses on Monday. And so now today we're going to look at different group treatment modalities for trauma, specifically looking at three types of groups, psychosocial support groups, treatment groups, and something we call process groups. And so we're going to use trauma and trauma recovery to kind of look at these different types of groups, settings, and types, so that we leave the class with an understanding of the difference between these groups and something about if you're wanting to work with someone who has trauma or whatnot. Okay, so our job today is to explore the differences between these three group processes. And we're going to look at it in the roles in healing of trauma caused by three types of traumas. One is domestic violence. The second one is the loss of a loved one. And yes, this is considered traumatic and can create trauma. Being diagnosed with a chronic disease such as cancer, so cancer survivor groups, cancer people who are just diagnosed with it. And so that's kind of our third type of trauma group that we'll be looking at. Okay. Our structure will be to go through each one of these, give them definition, characteristics, look at each of their benefits in the group settings. And at the end, we'll do some comparison and some case applications for each type of these traumas. Okay. So that's kind of our goal for today. So let's start with psychosocial support groups. Okay, these are structures that provide both emotional and social support to individuals who share a common traumatic experience. And again, probably the one that I'm most familiar with is, of course, domestic violence survivor support groups. And the purpose of these is to really do two things other than some education. One is to normalize people's feelings about what has happened to them. A lot of times when you're going through trauma and grief, you think you're the only one that is experiencing domestic violence or experiencing grief from the loss of a loved one. And you want to reduce isolation. One of the key aspects of trauma is people's tendency to isolate themselves and avoid getting into the world and being part of it. Okay. And of course, our two examples for psychosocial support groups are domestic violence survivors and grief support. In these groups, they can be either peer-led or facilitated by a professional, and emphasize shared experiences and mutual support. Now, a lot of times these psychosocial support groups are structured and they have an education element. And sometimes you do it with peers, usually peers who have gone through parts of the treatment or the majority of the treatment, and then they're going to share what they have, that kind of peer support type program. Others times you'll use peers as volunteers to lead group. Um, a lot of times these groups will start with a facilitator because they have the educational material component of it, or they may share facilitation processes with either a peer in the group, and then they facilitate the education part, okay? But it emphasizes, and this is the important part of this, is a shared experience and mutual support for each other. And that's really the facilitation skill in this one, is creating that group, that identification with each other, so that it reduces the loneliness that people are feeling. All right, so treatment groups, on the other hand, this is a professionally facilitated group focused on achieving therapeutic outcomes through structured intervention. Okay, so this is probably, you probably have heard examples of cognitive behavioral therapy. We did with addiction, we did the relapse prevention groups. And often these are facilitated by someone who has the professional knowledge to, one, do a treatment modality, but also to understand the symptomology of someone who has trauma, such as post-traumatic stress disorder or depression, okay? So really the two examples here, I mentioned cognitive behavioral therapy for trauma. I actually use CPT for incarcerated females that measured high on scales of PTSD. It was really effective and really good. Support for cancer patients. And this is where you're addressing things like anxiety and coping with the diagnosis and the prognosis of having cancer. Because we know, as part of the treatment modality, cancer survivors tend to have healthy coping mechanisms. They stay engaged in the world, and they really take control of the cancer instead of the cancer taking control of them, okay? The key features of these, and this is an important aspect of a treatment group, is, one, you usually use an evidence-based therapeutic technique such as CBT. And it's goal-oriented with measurable outcomes. So throughout the group with treatment, you're going to continually assess your clients to see if they're getting better due to the treatment modality that they're going through, okay? Now, a process group is a therapeutic group that focuses on exploring emotions, behaviors, and interpersonal dynamics, okay? The purpose is to deepen self-awareness, enhance emotional expression and relational skills. This is often used, for example, with survivors of domestic violence, patients navigating complex feelings about a cancer diagnosis. And the key features of this is it's open-ended discussion. There's no set curriculum for a process group. And the focus of the group, it focuses on group dynamics and interactions. So it didn't put in here, this usually requires a very skilled and seasoned therapist to do effectively. I've seen where novices have tried to do a process group, and it often doesn't go so well because it takes someone who can really regulate the room and really provide that open-ended discussion in a safe environment. So this is one that, out of all of the groups that we have, this one is the one that takes the most skill. Okay. So let's just look at kind of the difference between them. Okay. So the aspect psychosocial support group, it can be peer-led or professionally led. But the difference is, with treatment groups and process groups, it really should be professionals only, okay? The focus is on emotional support, shared experience, and then in treatment, it's symptom reduction and skill building. And in process group, it's emotional processing and relational dynamics. So you kind of can see, if you're kind of trying to decide what type of group you should do, this is a good kind of area to look at is what is your focus? What is your intent? And then that way you can approach it in the way you need. And then you can start looking at the structure. So psychosocial, they do tend to have a curriculum of some type, some educational component, but they tend to be flexible and discussion based, whereas treatment groups tend to be very structured and intervention based. And on the process group, there has to be a lot of intentionality. So there is semi-structured, but it's really about managing the interaction between the clients, okay? And then again, not only looking at the focus, but the goals is the goal for psychosocial groups is to normalize and connect, okay? In the treatment group, it's about managing symptoms and measurable outcomes again, and that's a very important consideration when doing treatment groups. And then the goal for the process group is emotional insight and personal growth. Now, the way that I've often seen these in combination when doing treatments is usually these two. You start with this one, and then you go to a treatment group setting. And then, but at the same time that you're either in the psychosocial group or the treatment group, you have them in a process group, okay? Because these groups kind of have goals or kind of talking about different areas of trauma, where in this one, what you're really wanting to do is have them process it on an individual level, on an interactive level. So a lot of times what you'll see is clients taking information, say they learned in the psychosocial support group, and they process it deeper in the process group, okay? So I don't want you to think that these are all mutually exclusive. They could be used in congruence with each other. But usually you do, usually if you think about addiction, I'll go back to addiction. Usually start with an educational group on alcohol and drugs. Domestic violence, so you usually start on an educational group about the dynamics of domestic violence. And then you go to that treatment group, the relapse prevention, the drug intervention with victims of domestic violence. It's a CBT group of some type or something, some modality like that. And then during both these times, you usually have them in a process group. So let's look at some of the applications to kind of clear this up from what I was just saying. So applications for domestic violence. So a psychosocial support group, its main goal is to provide a safe space for survivors to share their experiences. Now, when I say share their experiences, it's not necessarily on the deep emotional level that you'll get in a process group. It's about sharing common things that go on. In the treatment group, you address trauma symptoms using CBT or trauma-focused therapies, okay? So again, this one is about relieving those trauma symptoms that we talked about on Monday, okay? And then the process group explores things like trust, of course, self-esteem for survivors is a huge issue, and patterns of post-abuse, relational patterns of post-abuse. So the continued feelings and everything, because, in a lot of cases, especially if you're married in a domestic violence, you just don't get to dump the dude or the girl or them and move on. There's still things that need to be worked out, such as the housing, such as the vehicles. And sometimes what if they both go through treatment and they get back together? There's still going to be trust issues and relational patterns that need to be addressed. So that's really what we're looking for with the process group, okay? Loss of a loved one. Again, it's about grief sharing circles to normalize mourning, and that's the important one. A lot of people who lose someone close and really start feeling the trauma and the grief feel like they're the only ones that feel it. And so because all of us process grief differently behaviorally, but we usually all process it the same internally. Okay. And then in the treatment group is interventions for complicated grief or depression. So this is in a situation where someone was lost that was so close to the individual, and it's leading to grief and depression and withdrawal from the world. So we want to put some type of treatment intervention in place to kind of process that so that the person can move on. Usually, a treatment group is usually especially done when you see someone becoming suicidal after losing someone close to them. And then a process group is really about processing those unresolved feelings about the loss that they had. So these you kind of get through the normal mourning phases. This, if it gets deeper than this one, we go to this. This one is when you're coping with the mourning, you're coping with the loss, and you're doing okay, but there's always these unresolved things, like maybe the thing you didn't say to them, or maybe there's these reminders that kind of push you back a bit. And that's what process groups are really good for when dealing with the loss of a loved one. Okay. And then with, for example, cancer support groups for cancer diagnosis, we usually look at peer support to navigate shared challenges of treatment and survivorship. In treatment, it's about management of the anxiety and increasing that emotional resiliency. Because again, both of these, reducing anxiety and increasing resiliency, has actually ended up providing better prognosis for cancer, people who are going through cancer, and their prognosis actually becomes better. Even if they have the best treatment in the world, their chances still increase better with resiliency and anxiety reduction. Process groups, this is when you start processing the existential questions like, why me? What does this mean? And identity change. When you have a chronic disease, your identity of who you are changes in some way. When I was diagnosed with congestive heart failure about 5 years ago, my entire self-perception changed about who I am and my health and what I can do and what I can't do. And process groups really allow people to really look at those changes that they're seeing and feeling and really help them develop a new sense of identity with this now diagnosis or this now chronic disease that the person has now. So just to kind of conclude this, well, I'm not going to keep you guys here very long unless there's a lot of questions. That's all right. Each group type addresses a unique aspect of trauma recovery, and that's an important thing to keep in mind. Where you put your client is dependent upon those goals you want them to achieve. It's a bad idea just to throw your clients in all three types of groups with no goals in place of where you and that client want to head with their healing. Okay. So again, psychosocial support groups foster connection, treatments target symptoms, and process groups promote deep emotional healing. Okay. So the key takeaway, understanding the distinctions ensures appropriate group placement for trauma survivors. And that's a very important aspect to consider. And with that being said, well, I went through this one quick. Let me